Welcome back. You're still watching.
All right, welcome back. Thank you so much for staying with the program. You're watching Morning Cafe. Being a Thursday, we are talking matters health. And this morning, we want to talk about something that sounds so futuristic, but is already happening here in Kenya. And we'll be speaking with Dr. Ashni Maldi, an aesthetic doctor and managing director at TIA Clinics, to tell us how we are doing in Kenya as far as regenerative medicine and treatment is concerned. We'll also be focusing a little bit on functional medicine. And this is something that deals with the body healing itself, a lot of stem cells being talked about today, this morning. So do stay with us and interact with us on our socials, TV47 Kenya on Facebook and on YouTube, on X, at TV47 Digital. You can tag me as well at @_Dida. And if you do have a question for Daktari here in regards to whatever you're talking about this morning, regenerative medicine, then you can be sure to call in. There will be a number on your screen very shortly. Karibu sana to TV47. How are you this morning?
Thank you so much. I'm good. How are you?
Doing fantastic. Let's set the pace for this conversation. Regenerative medicine. You know, it sounds so cliche and a very complex term, but to break it down for a viewer and for the benefit of their understanding, what is regenerative medicine?
So I'll start off by saying regenerative medicine, and what we focus on in Kenya is majorly stem cells. Mm-hmm. We get stem cells from your own blood. And so it's something very natural because your blood has the capacity of healing itself. Mm-hmm. And so we use those stem cells to regenerate hair. Mm-hmm. We use it to regenerate skin. We use it for pain management. We also use it for male and female rejuvenation. So we're trying to use your blood and your stem cells to heal anything in your body, literally. Mm-hmm. That's what it is.
So how does it differentiate from functional medicine? And if we join these two together, we also have the conventional medicine and the traditional medicine that we're used to. Then how do they differentiate and how do they come to play differently?
Okay, regenerative medicine and functional medicine is the way forward. Mm-hmm. Only because we want to try and move out of conventional medicine. Of course, we can't move out of it completely. Mm-hmm. But there's so many things, so many diseases, so many situations, so many treatments that can be done without intervening. And so regenerative medicine, as I just explained, comes from your own blood. Mm-hmm. Stem cells come from your own blood. And so it's so natural. You're not looking at side effects. But of course, it's the future, but we have to be hand in hand with conventional and traditional medicine. Functional medicine is something that's very interesting, actually. Functional medicine can literally age your body backwards as good as 20, 30 years. Mm-hmm. And so that's what we're trying to do. Like we say, prevention is better than cure. And so you want to take care of your body before anything happens. Mm-hmm. And that's what functional medicine is all about. Mm-hmm.
So it has a lot to do with therapies. Just, for the basic of understanding and to set the pace for this conversation. Right now we are seeing a lot of people going for surgeries to look younger or, to increase the boobies, the butts. Is it one and the same thing in simple terms?
Not at all. Mm-hmm. Augmentation is plastic. Augmentation is plastic surgery. Augmentation, yes, is good. I feel like at this point, sometimes we're just out of the way in doing those things. However, just to clarify, functional medicine is not going to enhance you or is not going to make you look different from what you are. It's going to make you look better, but not different. And so you just imagine yourself looking 10 years younger. Imagine yourself not having any wrinkles. Imagine your knees not hurting. Imagine you just being slim the way you are all your life. So that's what's functional medicine. We're preventing. We're preventing you from being big. We're preventing your wrinkles. We're preventing your knee pain. And so that's how it's different. But in simple terms, this is non-invasive. We don't do surgeries. Most of them typically are just injections. They're once in a while. It's as easy as once a month, sometimes as hectic as maybe once a week, but that's it. And there's a time limit to it. You don't do it forever. So we have protocols. We're doing a 2-month treatment or a 3-month treatment, but that's it. And then you probably come back to us maybe once in a year or once in 2 years just as a maintenance, for a maintenance. But so it's non-invasive, very easy, small injections, not time-consuming, no downtime. So we're basically preparing your body not to age at all. Yeah.
So it's more of an aesthetic procedure, because a lot of people may wonder, if I want to look quite young, that is not something that, you know, everyone would want. There are people who really appreciate the gift of growing old and looking old, or just being young and looking their age. But that now can be categorized as now an, what is it called? An aesthetic procedure, right?
Yes.
Talk to us about the treatment. We've heard about a lot of insurance companies not covering such procedures, aesthetic procedures. Does it cover regenerative procedures and functional medicine procedures, and why?
Unfortunately, no. Nothing in the aesthetic world is covered by insurance companies. And that's a fight that people have been having since the 1960s. Even in the US, they don't cover for aesthetic procedures because it's considered a luxury. And the fight is that, yes, it's luxury, but it's also affecting your self-esteem. Things like obesity are actually considered a mental disorder. And so we try to, well, when we fight, technically, we're trying to push these things to get covered in insurance. But yeah, it's not, unfortunately.
So for people who would want to have this procedure, you know, in their lives, the regenerative medicine, regenerative treatment, this regenerative procedure, but they cannot afford it, what is the cost in terms of affordability, accessibility? How is it?
It's actually very affordable. It's more affordable than surgery, so to say. You're looking at spending anything like 30 to 40,000 a session. When we do regenerative medicine or we do the treatments, you're looking at spending that 45,000 once a month for 3 months, and that's it. And so technically you're looking at spending about 135 to 150,000 within a span of 3 months. Which is quite affordable for a larger amount of people in the country. Likewise, functional medicine, we're talking as cheap as 30,000 a month. And so you can see it's quite affordable. It's not something that's out of the way. It's not something that's exclusive, just the way the name is. So yeah, we actually push this because we try to make it affordable for a larger class of people. Only because, yes, you want to look good, but it's not just about looking good. It's not about aging gracefully or aging and just accepting the way you are. Some people do have issues with the way they look. I'll give you an example. Yes, you may have wrinkles, and yes, you like it. Yes, you're 50, but you could look a little bit better. And so you could just be in your own skin, look a little bit better, get some procedures done. Doesn't mean that we're stopping you from aging. Doesn't mean I'm going to make you look 18. So it's technically a necessity these days. With all our social lives these days and the way we want to be presentable, and like back in the day, our parents didn't care about how they looked or what they wore. But for us, everything is social media life. And so we really want to be presentable, and that's why we're here. Yeah.
Is this something that you truly do recommend for people to, a procedure that people should go through? As you know, somebody who's watching right now and he's hearing about regenerative medicine, you're saying it makes you look younger, it makes you look maybe beautiful, it does enhance your features, right? Is this something that you would recommend?
Definitely. I've done so many procedures on myself as we speak now. But okay, even if I'm not an example for a lot of people, you may have wrinkles, you may want to do Botox for it. Doesn't mean you're going to be looking plastic, doesn't mean you're going to be botched. You may have lost hair. A lot of women lose hair because of traction, because of lots of braiding and lots of chemicals, and that affects your self-esteem, and that's why we're here to restore it for you. You may be big just because of odd lifestyle, or you may be so stressed, or you may have had a bad phase in life and ran to food for comfort and added on so much of weight and not realizing it. That's why we're here to get you back to going slim. So yeah, all these things, just very basic things, which may just be a necessity and not actually just for you to look better than what you are.
It's all about social media pressure, right? Because if you're looking at it, and somebody might be watching and it's so traditional maybe, somebody from the far-flung areas, say Kisumu, those areas, Wajir, but they're wondering why would somebody want to take this procedure? Is it pressure?
I think so, definitely actually, because we all want to look good. I think it's just we're being judged by society and we're being judged by people on how we appear, what we wear. It's all about status these days. It's all about that social media. Funny enough, I do turn down a lot of my patients who come to me because they want to look so out of what they're looking naturally. So it's so serious, I can say, to the point that someone is bothered about stretch marks and how stretch marks are going to affect their appearance. I mean, they're under your clothes. It's not going to affect anyone. Even if you're going to go to the beach and put on a bikini and have stretch marks, no one is staring at your stretch marks, to be honest. But like you said, it's become so much of social influence that we want to just look photoshopped in real life. Yeah.
So what are the risks associated with regeneration medicine, and how do you minimize them or address them before you take this procedure on a patient?
The best thing about my practice is I don't have side effects to any of my treatments. We're already treating a problem, so we can't have another problem to the problem. But as I mentioned, regenerative medicine is purely stem cells. It's from your own blood. Your own blood can't react on you, so clearly there are no side effects at all. Yeah.
Very safe.
Absolutely safe.
Talk to us about PRP, the platelet-rich plasma. What exactly happens when you take somebody's blood, you spin it, and then you enact it again? Talk to us about that.
PRP is outdated. I don't do it because it was done in the 1960s in the US. We did adapt it probably towards the 2000s, but we do something called growth factor concentrate, which is advanced PRP. So I'll just very quickly basically explain to you the difference. You have something called growth factors in your blood, and when you do PRP, you will only get about 40 to 60% growth factors, as opposed to when you do growth factor concentrate, you get 100% growth factors. So again, layman, if you're going to remove orange juice from manually, you'll get only about 40% orange juice. As compared to if you're going to do it through a machine, you'll get 100% orange juice. So you can see the efficacy of a growth factor concentrate. We're a pioneer in Kenya, and we've introduced the growth factor concentrate therapy kits, not just for myself, but for a lot of doctors to use in the country. And we've gone ahead to do so much of research that we've introduced our growth factor concentrate with additives. So I'll explain what that means. If we want to enrich your hair, biotin is essential. Biotin is vitamin B7. And so we have biotin in the growth factor concentrate. So it's like orange juice plus protein powder. So you can understand the efficacy of that orange juice. And so the growth factors on its own have the ability to regenerate the hair, but the biotin will enhance it. And so we have that for all the different procedures. If we want it for the skin, we have an additive for that. And so when you have 100% growth factors, regeneration can happen within 90 days. So total regeneration, we promise you 80 to 90% regeneration. And that means that you only require 3 procedures, 1 a month for 3 months, and you're good to go, technically for the rest of your life.
Are there possibilities of it relapsing? Because you see, we've seen a lot of procedures. Maybe somebody got Botox and it didn't work out, it relapsed, or the boobies grew bigger again, if somebody wanted them smaller or if somebody wanted them bigger. Are there chances of a regenerative procedure, dropping after that procedure is done?
So 2 things. Aging is a constant process, and so you can't stop aging. And so you require maintenance. Just the way your car would require maintenance, so does your body. And so I can't tell you you're just going to come to me once in your lifetime. Also, lifestyle matters. Are you stressed? How stressed are you? What products are you using? How natural are you? How's your lifestyle? Are you a chronic smoker? Are you a chronic drinker? Everything contributes. So I won't say that there's no relapse. Definitely there's relapse. But it really depends on person to person how long the relapse takes. And technically things like Botox actually just wear out in 8 months. So it's a procedure that you're going to do every 8 months. Yeah.
So relapse is bound to happen, but you said that sometimes it varies person to person. So technically, how long does it take? Could it be 3 months or about roughly, or a year or 5? How long?
You could do the antioxidant therapy with me, which is one of our treatments, which helps you in all ways possible. Like, it boosts your immunity, boosts your energy levels, brightens your skin. So when you do that, you can come back to me maybe after 4 or 5 years. When you do the growth factors, the regenerative medicine, maybe you'll come back to me after 2 or 3 years. So we're talking that span. But if you're doing Botox, you're going to come back to me in 6 to 8 months. If you're going to do a non-surgical facelift, that's going to be another 3 to 4 years before you come back. Yeah.
You know, this is not something we hear a lot in the country. We see when a lot of people want maybe this facelift and to change their appearance, how they look. Usually we see them go to Turkey, to India to have these procedures done. Are we as Kenyans embracing the availability of such procedures in the country?
Yes. It was a rough road when I started back in 2020 because patients wouldn't understand what a hair transplant is. But I think patients are so much more educated now, and they know what they want. They know that what they're going for. But also, this is the reason I encourage a lot of doctors to start practicing, because when we practice as a whole group, it makes so much of a difference, because it gives you confidence as a patient that yes, this treatment is widely available in Kenya, and it's not just one person doing the treatment in Kenya. And so then we stop, or at least we reduce those patients going out and getting them done in different countries.
So what problems maybe did you see that, you know, the traditional form of medicine wasn't solving? And then now you saw that, let me start this clinic that will now give Kenyans and my patients a chance to come and have these regenerative procedures done on them. What gaps did you see?
Well, we're always advancing, and I tend to advance myself a lot, or do a lot of research on a lot of the products and procedures that we offer. That's technically what doctors should be doing. Unfortunately, and I'm going to have a lot of backlash for saying this, unfortunately, doctors just stick to the mortar and pestle way of doing things. They just don't want to advance themselves. But as doctors, we're learning till the day we die, and so we have to keep implementing something new that's in the market. And the reason for me to do it majorly was only because nobody was offering it in Kenya. Even if they were, there were very few. And so we wanted to have that push. I wanted people in the country to understand that I can do things in my own country rather than traveling to Turkey, where you have a language barrier, where if it's botched, who are you going to go and look for? You know, at least you're in the vicinity of your home and getting things done. Yeah.
Have you had to deal with botched procedures?
Yes, a lot. And it could be just because patients are self-medicating, or it could be botched procedures from other practitioners. But yes, quite a bit.
When you talk about self-medicating for a couple of patients, like you mentioned it, how does it now happen, self-medicating? And we're going to discourage it, even as you explain to us what it is. Because if I'm talking about regenerative medicine, regenerative procedure, the best way to do it is come to a professional to do it for me. But self-medication, how does somebody do it to try and make themselves look younger, to, you know, reduce whatever they need to reduce, or increase whatever needs to be increased?
Unfortunately, Dr. Google, because everybody wants to Google everything. I have maybe about 30, 40 patients who come to me and tell me, you know, I read online. Okay, so if you read online, then do it yourself. Why did we spend 10 years studying what we know and, you know, practicing what we know, or what we've learned, and you come and tell us you read it on Google and you've become a doctor overnight? And so this is our biggest problem. And everything is so available over the counter these days. And so it's just hard for us to explain to patients why what we're doing is right, because they think they know what is right, actually. It gets so bad because I have patients who come to me and tell me, you're going to inject me Botox here. This is how much I want. This is how you're going to inject. This is how you're going to dilute. No, you can't tell me that. Yeah.
So what do you look at before somebody, you give somebody a go-ahead with this procedure? Talk about the comorbidities, the age factor. What do you look at to tell somebody that now you qualify for this procedure?
I don't treat anybody below the age of 18, or let's say 21 in some, conditions. But otherwise, nothing. If you're 21, you're bothered about your wrinkles, I will Botox you. Only because I keep saying prevention is better than cure. It doesn't mean that if I'm going to Botox you at 21, you're going to get worse by the time you get to 50. We're just preventing something. And so otherwise, technically everyone is a candidate for me. Unless, of course, just basic things like pregnancy, lactation, that's one of our biggest contraindications. We don't treat pregnant mothers. We don't treat lactating mothers at all whatsoever. They can wait until they're done and then come to us. And otherwise, very rarely if a chronic condition. But yeah, we even treat cancer patients, burn patients, everyone.
So what alternative do you recommend for those who don't qualify, these pregnant mothers, say those who can't do it because of age or something in between? What alternative do you recommend for them? But they still, want to do what others are doing.
For pregnant women, I tell them just embrace it, enjoy your pregnancy, enjoy your journey. It's never going to come back. You may have another pregnancy, but it's going to be a different journey. And so just enjoy the way you look, enjoy the way you feel. You don't have to go out of your way to, look someone else or look something else. But otherwise, unfortunately, sometimes we don't have anything else for patients who are not qualified for my treatments. Only because we're really at the advanced stage. What more can they do anyway? But yeah, sometimes there are options, there are alternatives. So we go back to traditional medicine.
For somebody who may see this as an anti-aging procedure, how do you set these realistic expectations for them? Somebody would come there and all of a sudden from the get-go, they just want it done there and there. So how do you set these realistic expectations for your patients?
I actually turn down a lot of patients. If you're going to walk in with a photo of Pamela Anderson and tell me you want to look like her, I'm just going to say no, and I'm not even going to treat you. And so yes, I'm okay to lose the business, but I don't treat you if you have unrealistic expectations. I will tell you what I can achieve. Unfortunately, we can't ever achieve 100% when it comes to looks. So it's always anything between 60 to 80 or maybe 90%. And so I set that expectation for them, knowing that they're not going to get anything more than what I've already told them.
Is there any support, say, from the government or the Ministry of Health to just try and promote such procedures? Because I understand that with regenerative medicine and procedures, clinics are very, very minimal, if at all. If yours is anything to go by, only anything to go by. Is there any support that you as regenerative procedural doctors are getting?
Definitely. I think I've had so much support. I've really grown in my career, even from regulatory bodies. They've really assisted in giving us a green light to do so many of these things. I think they appreciate it. And the best part is, fortunately, we will have it on our national insurance very soon. I'm not giving a word for it, but this would be my wish. And so I think that support is always there for me.
Talk to us also about the possible red flags. What should a patient look out for, before walking into a clinic for a regenerative treatment?
Nothing really. You have nothing to lose.
Due diligence?
Of course, that's normal. I mean, you have to be registered. You have to be a doctor. You have to be registered with the regulatory bodies. Don't walk into a quack salon that's doing things behind the doors. That's one big problem we have, because we have so many unqualified people doing these procedures, and they do it so cheap, and unfortunately it kills our market, because when we're offering something premium, people think we're just really expensive for no reason. But otherwise, if you're sure of the doctor, if you're sure and you know of what they're doing, and you're happy with their explanations, you're happy with the consultation, go for it, because with regenerative medicine, functional medicine, you have nothing to lose. There are no side effects. Worst case scenario, it just won't work on you, but that's also very rare.
All right, let's sample a few of some of the feedback we're getting from social media. Godwin Achola, you're watching from Homa Bay County. Thank you so much. Ella Mwachi is following us live, and Nelson Bet is also following. Francis Okanga, Sharon Kanano, we can see you. Honorable Austin Wambingo is saying, eager to learn more about self-medicating, following keenly. He would love for you to expound on self-medication. She said, Dr. Google. But there's another question here for you. How is it being used, this regenerative procedure, in areas like heart repairs after heart attacks, spinal injuries, or even organ damage?
Actually, I think spinal injuries, regenerative medicine is the best. It's considered actually an alternative to surgery these days. And so I really encourage doctors, because not every patient that comes to them is a candidate for surgery. And so definitely they should consider using growth factors or growth factor concentrate, because you can cater to that percentage of your patients who are not candidates for surgery for whatsoever reason. Otherwise, when you talk of heart conditions, heart attacks, or liver disease, or things which are more internal, then I think functional medicine plays a very big role. Only because we've been able to repair, regenerate, heal tissue. We've been able to reverse so many conditions. We use something called peptides. And if I take you back to your science days of school, peptides are the building blocks for amino acids, which are the building blocks for muscle. And so that all means that when we're injecting a peptide for you, if it's the relevant peptide, it can literally heal anything in the body.
Interesting. We are seeing a lot of lifestyle diseases coming up. They're rising. Diabetes, hypertension, obesities. Can regenerative medicine play a role in prevention or just repair?
Functional medicine?
Yes.
Yes. We have peptides that promote fat loss and build muscle in return. And so we're so big right now on obesity and weight management. And the peptides actually can help you to shed off all the excess weight, not make you sag at all, so you don't have any hanging skin. You get to the best shape of your life. And because it's building muscle, it also builds lean muscle, which means that it improves cardiac health, it improves everything literally internally in your body. Remember, weight is one of the biggest predispositions to all the other chronic diseases in the body. And so when you're big, you will have your diabetes, you will have your hypertension, you will have all of that. If you can rectify your weight, you've rectified everything in your body. Yeah.
So what's the first step that should a patient take before walking into any clinic? If they come to yours, because you say you turn down some of the patients, before they come there and you tell them, no, go back home. So what should they do before walking into a clinic for a procedure?
Well, they have to come for me to turn them down, so to say. But consultation. Consultation is key. Do a consultation with your doctor. Do a consultation with me. Don't come insisting that you just want to do the procedure and you don't want to consult, because I'm the one giving you the advice. I am going to interpret, or I'm going to look at you, get your medical history, understand everything before I advise you what to do. Yeah. So
all right.
Consultations are key.
Consultations is a key. There was a question here for you. The role of nutrition, lifestyle, and gut health. What does it play in functional medicine? Because you talked about lifestyle being quite important when somebody has undergone a procedure. be it regenerative medicine or a functional medicine. So how does nutrition and lifestyle come to play after this procedure is done?
Wow, this is one of the biggest controversial topics we've been having on social media in relation to me, not in general, because again, back to basic science, you are supposed to have your 3 meals a day. That's what we know. Unfortunately, people say that it's only white people who should have 3 meals a day.
Oh, really? That's a myth?
I don't know, but scientifically, and if we've studied our body and our organs and anatomy, your body is producing enzymes to digest food every few hours, which technically means you should have 3 meals a day. We have ever learned of having a balanced diet, but we're just in this fad of intermittent fasting, keto, cutting off your carbs, cutting off your sugars, cutting off your fats. That is not sustainable. And so I teach my patients sustainability. And so you want to eat everything. I mean, how long in your life are you not going to have your pizzas or your nyama choma? You want it. So yes, diet plays a role, but anything that you will overdo will not be good for you. So eat everything, but eat it in limited portions because your body needs the fats, your body needs the carbohydrates, your body needs the sugar. And so everything is essential. And so a balanced diet, limited portions is what is key, is what is sustainable.
Let me take you back. You talked about fellow doctors, your fellow doctors are quite very reluctant on learning more and embracing such procedures, regenerative medicine and regenerative procedures and treatment. Why do you think this is the case? If at all every day is a learning day for doctors, then your colleagues are very reluctant. Is it about how the market looks like in the country? Is it about how the cost would look like and how, if the reluctance comes from, if Kenyans would actually embrace the regenerative procedure, what is it exactly?
Unfortunately, and I think I'm going to cut off my throat by saying this, but it's toxic pharma world. Pharmaceutical companies, and I own one myself, so I'm just talking in general. We pump so much of money to doctors just to promote our products. And so, and this is very raw, but everyone is just prescribing you drugs only because they're getting something from the other side. And this is the reason no doctors want to move out and actually do something that actually helps patients. And well, this is why we don't want to advance. We have to advance. As I mentioned, some of these treatments are so much more cheaper than what people think. And if we're not going to embrace it as doctors and tell our patients about it, then clearly we're just prescribing you medication all your life. And this is why I push my colleague doctors when I go to push my product to them and tell them that you have this certain percentage of patients who have no other option, but you can use this as an option. And so we have to advance ourselves, otherwise we're just going to remain behind and every other country in Africa is going to advance themselves and will not be there, or even in the world, so to say. Yeah.
So it's about business. People are doing business.
Technically, yes, and it's key not to. We swear, we take an oath that we're going to save patients. We take an oath that we're going to do anything for patients. And I think we should do that.
How does the aftercare after a regenerative procedure look like in details, step by step?
No side effects, no downtime, walk in, walk out, do whatever you want in life, no medications, no painkillers. I literally make you live your lifestyle the way you want to. I take you off all your medications, I take you off all your painkillers. Some medications which may be very important or very necessary, I cross-refer back to your doctor for them to decide if they want to wean it off or not. But literally with my procedure, it's a walk-in, walk-out, and you go live your life.
All right, interesting. There's a question here for you. How does this approach empower patients to take charge of their health, and how does functional medicine approach chronic illness differently?
Funny enough, some of my patients think I'm not a doctor, only because they expect to come in and be written 2 pages of medicines. And when I tell them you don't need to do anything, you're good, they don't believe in me. But yes, patients are really embracing the fact that they don't have to do much. I think when they go out there in the world and see how advanced things are, they do come back home wanting to have the same things done at home. So yeah, we're getting a lot of patient acceptability for sure. Yeah.
That question on chronic illnesses, how does it approach chronic illnesses differently, functional medicine?
Let me just say it. We cure so many chronic illnesses. We've been able to cure diabetes, we've been able to cure cholesterol, we've been able to cure liver cirrhosis. We've been able to help kidney failure patients, literally, with our treatments. It's actually that good. And as I said, you have nothing to lose. You may spend some out of your pocket, but worst case scenario, it may not work on you, but there's nothing for you to lose. I've treated, I'll just give you one example. I've treated a girl, 32 years old, who was due for a kidney transplant and has been deferred from transplant for almost 4 years now. So I haven't treated her, I haven't regenerated her kidneys, but at least we really helped her. From her being non-functional, at least she's so much more functional now. And so we've improved her quality of life. That's how good it is. Yeah.
So with regenerative procedure, it has the possibility and potential of completely curing a certain disease and not just preventing it, because we've talked about diabetes and many times we've talked about it on this show, some doctors saying it has no cure. But with regenerative medicine, what you're saying is sometimes when somebody, a patient, a diabetic patient will come to you for that procedure, that they would walk out completely cured from diabetes, for instance?
I'm not the specialist, and so I only help my patients when they come to me because they're coming to me for other aesthetic procedures. But yes, I have cured them. Of course, lifestyle matters. If you're going to not exercise and continue eating your carbs, then I can't help you. So contradictory when I said you should eat your carbs, but in limits. And so if you can maintain your lifestyle, yes, I promise that sugar is going to go away.
There are concerns from also a few of arthritis patients or people who have parents who have arthritis. And the concern is, how does now this regenerative medicine change the way of treatment for them? You know, what they're used to traditionally or the conventional way of medicine. So how does regenerative medicine help with those, you know, pain in the knee joint and those who have arthritis in general?
As I said, it's considered alternative to surgery. And so in our initial clinical trials, we proved that anyone who's suffering from arthritis, even up to grade 4, can be treated. We won't build back the intra-articular fluid if that's what makes sense to people watching the show or even doctors. But it builds back your tendons, your ligaments, your muscles, your cartilage, and so we improve quality of life. We reduce the pain. We reduce the pain up to 90%. It's also proven to sort of replace the intra-articular fluid, but not 100%. So all in all, when I'm explaining this, there are candidates there are patients who are not candidates for surgery. This is the most amazing thing they can do for themselves. The growth factors, the regenerative medicine. Yes.
There is a very good question here for you, and I think it's from a student doctor or a doctor. Could you speak to the difference between bench research and clinical translation in regenerative medicine? And she's called Anjiri. She says lab experiments, animal models, and cellular assays.
Okay. Back to her. Just go online, look for scholarly articles. There is enough research, enough clinical trials on regenerative medicine, on functional medicine. I'm doing some on my own. I unfortunately just don't have time to write papers. But definitely there's so much of backed up data, so much of backed up science on these procedures, and is why we have embraced it.
All right. As we come to the tail end of this conversation, where do you see the future of regenerative medicine? And let's start with Kenya, and then you can talk to us about the global lens as well.
Kenya is the hub for Africa, not just East Africa. We as doctors should push for Kenya to be the hub for everything when it comes to medicine, because we have so many patients who come from neighboring countries just to look for services in Kenya for medical services. And the way forward is, the future is bright. We're going to be so advanced with so many things, and ideally functional medicine and regenerative medicine is going to be so advanced that we're going to be able to do anything in your body. It's actually literally already so advanced that it's curing cancer. It's curing so many diseases that are incurable. And so much research has already proved that. So definitely we'll be able to technically reverse anything in your body.
How do you deal with criticism or respond to criticism? Because we've seen a lot of criticism on social media, the way people try to change themselves. Let's talk about bleaching. A lot of backlash. We've seen it ongoing on social media, people who choose to bleach their skins. And now you're talking about regenerative medicine. It's having the potential of making you look younger, different from how you look, depending on what somebody wants. But now how do you respond to that criticism that regenerative procedure medicine is overhyped?
I love it because I know what I'm doing. I prove myself. I'm not going out of my way to do anything that will make you look out of the way. I'm just regenerating you, and I'm just reversing aging, or I'm just helping you look better. So I love the criticism. I'm open to it all the time. I'm very ethical. And so I always stick to my ethics, is the reason I turn down patients when they want to come to me and look plastic. But yeah, unfortunately, sometimes people just talk because they don't know what they're talking. We're years of education, years of research, years of clinical trials that we do, and then is when we're putting something on the table. So not unless they know what they're saying, which would end up in a debate with me, but it doesn't matter to me what they say. I get it a lot, is why I'm saying this. But people don't understand. You can do something, or you can do procedures only just to make yourself better. It doesn't mean that we're showing off, or we're, it's overhyped or anything like that. Yeah.
Is this something that you talk to your patients about when they come to your clinic? That they might receive a little bit of backlash, and we know how this can affect somebody psychologically, mentally, what it can do to them. For you, you say you do not care, and that is a mindset that I know it grows over time. But for a patient who's coming to you for this procedure, they don't know what awaits them. Do you talk them through?
Absolutely. Is why I said consultation is necessary. A lot of counseling goes down during consultation. And so to say, I attend to my patients myself. I'm always there for my patients. If I'm not in the clinic, we don't see patients. So I don't leave it on my nurses or my staff. And so I think patients get that comfort that I'm always there, where I'm walking the journey with them. And I would say almost all my patients are my really good friends. Half of my patients are my best friends, only because they believe in me. And so that counseling is absolutely necessary. They know what to expect when they walk out of my clinic.
All right. As we wind up now, Dr. What would you tell somebody who is watching right now and is quite hesitant? They want to, but they're scared. What would you tell them about this procedure as your final remark?
Back to square one, come for a consultation. You have nothing to lose. At least I'll be able to explain everything to you. I'll be able to educate you on what's important, what's not important. I may even just demystify something that was already stuck in your head, but is actually not even ideal for you. And so I'm very honest and very ethical in my consultations. It's not all about money. We want to tell you the truth and what you should expect. And then now you decide what you want to do. I never do procedures on the same day of the consultation, very rarely though, unless you've made up your mind. And so I always allow you to go back, sleep on it, reconsider what you want to do, and then come back for a procedure. Yeah.
So where can they find your clinic?
We're in Muthaiga, we're in the neighborhood, just next to Gertrude's Hospital. And you can call 0799 995716. And yeah, that's where Tia Clinics is.
All right. That is Dr. Ashni Maldi, an aesthetic doctor and managing director at Tia Clinics. Thank you so much for making time for us.
Thank you too for having me.
Something about regenerative medicine and functional medicine as well.
Fine.
That's it for this conversation. Thank you so much for watching. You're watching Morning Cafe. Good morning. My name is Anne Odida.